Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. When you think of a dangerous bite, you probably picture a dog or a snake, creatures whose bites are known to be painful and potentially deadly. Most people are quick to worry about animal bites, imagining sharp teeth and venom, but there's another type of bite that's often overlooked. But a human bite can be just as risky, and sometimes even more dangerous than an animal bite. The human mouth is full of bacteria, hundreds of different types. While these bacteria are usually harmless inside your mouth, they can become extremely dangerous if they're injected under the skin through a bite. Human bites happen more often than you think, during heated arguments or fights, from playful toddlers who don't know better, or even accidentally, like when a fist strikes someone's teeth in a scuffle. These wounds are especially risky because the bacteria get a direct route past your skin's natural defenses, making it much easier for infection to set in quickly. Unlike a clean cut from a knife or sharp object, a bite crushes and tears the tissue, causing jagged wounds. This creates a perfect environment for bacteria to thrive and multiply, increasing the risk of serious infection. Even a small bite that barely breaks the skin can introduce dangerous bacteria like Streptococcus, Staphylococcus, and Eikenella. These bacteria can cause severe infections, sometimes spreading rapidly if not treated. That's why you should never ignore a human bite, no matter how minor it seems at first. What looks like a tiny wound can quickly become a big problem if left untreated. Immediate cleaning with soap and water, applying antiseptic, and knowing when to see a doctor are crucial steps to prevent complications and keep the wound from getting worse. Let's look at how to recognize the warning signs of infection and what you should do next to protect yourself from the hidden dangers of a human bite. After a human bite, it's crucial to monitor the affected area closely. Look for a break in the skin, any bleeding, redness, pain, and swelling. These are the initial signs that something might be wrong. If you notice that the redness is spreading, the area feels unusually hot, the pain is intensifying, or pus begins to appear, these are strong indicators that an infection is likely setting in and needs attention. Systemic symptoms such as fever, chills, swollen lymph nodes, or a general feeling of being unwell suggest that the infection could be spreading beyond the initial site. This is a serious concern. These are red flags that should not be ignored. Don't wait to see if it improves on its own, as delaying can lead to more severe complications. Human bite infections can escalate quickly and become dangerous if not treated promptly. They can lead to severe health issues if left unchecked. Seek medical attention immediately if you notice spreading redness, pus, or fever. These symptoms indicate that professional medical intervention is necessary. Go to urgent care or the ER for a proper assessment and treatment. Medical professionals can provide the necessary care to prevent the situation from worsening. Early intervention can prevent serious complications and long-term damage. Addressing the issue promptly can lead to a full recovery without lasting effects. Don't gamble with your health. Get help fast. Quick action can make all the difference in preventing a minor issue from becoming a major health crisis. Next, let's see what happens when you arrive at the doctor's office. Understanding the process can help ease anxiety and ensure you get the care you need. When you arrive at the clinic with a bite, the doctor will start by asking detailed questions about how and when the bite happened. They'll want to know what kind of animal or person bit you, how long ago it occurred, and whether you've cleaned the wound at home. This information helps them assess your risk for infection and other complications. Next, the doctor will carefully examine the wound, checking its depth, exact location, and looking for any signs of infection like redness, swelling, or pus. They'll also check for damage to nerves, tendons, or blood vessels. If the bite is close to a joint or bone, or if there's concern about something being left inside the wound, an X-ray may be ordered. This helps the doctor look for hidden fractures, foreign objects, or even pieces of tooth that might have broken off during the bite. The first and most important step in treatment is thorough cleaning. The wound will be irrigated with a sterile solution to flush out as much bacteria and debris as possible, reducing the risk of infection. If there's any dead or badly damaged tissue, the doctor may need to trim it away, a process called debridement. This helps the healthy tissue heal faster and lowers the chance of infection taking hold. Most bite wounds are actually left open to drain, rather than stitched closed. This is because closing the wound can trap bacteria inside, making infection more likely. The doctor will explain how to care for the wound at home. You'll probably be prescribed a broad-spectrum antibiotic to fight off the mix of bacteria that live in mouths. Taking the full course is important, even if you start to feel better. If you haven't had a tetanus shot in the last 5 years, or if you're not sure, the doctor may give you a booster to protect against this serious infection. Quick, proper treatment is key to preventing serious complications like deep infections, loss of function, or even sepsis. Your doctor will give you advice on what to watch for as you heal. But what if things don't go as planned? Let's talk about the risks and what can happen if a bite isn't treated properly. Ignoring a human bite can lead to serious complications. Abscesses, painful pockets of pus, often require surgical drainage. Bites near joints can cause septic arthritis or bone infections, sometimes needing hospitalization and surgery. Cellulitis, a spreading skin infection, can develop rapidly. Rarely, necrotizing fasciitis, flesh-eating disease, can occur, requiring emergency surgery. Blood-borne viruses like hepatitis B or C are possible, though rare. That's why full honesty with your doctor and prompt care are essential. The best strategy is prevention. Avoid situations that could lead to bites. De-escalate conflicts and protect your hands and face in risky situations. Parents, supervise young children, teach them to express emotions with words, and reinforce gentle behavior. In workplaces with behavioral risks, training and protective gear are vital. Recognize triggers and act proactively to prevent bites. If a bite does happen, act fast. Clean the wound and seek medical help. Human bites are serious, but with awareness and quick action, you can avoid lasting harm. Stay safe and take bites seriously. UMCC, your ultimate medical consultant connectors.